Good afternoon, everybody. Thank you for joining the virtual briefing done jointly by the American Immigration Council, American Immigration Lawyers Association, and our joint project, the Immigration Justice Campaign. The briefing is on the U.S. treatment of immigrants in detention and how that is endangering the public health and the health of detainees during this pandemic. I'm Greg Chen. I am the Senior Director for Government Relations at the American Immigration Lawyers Association. I'll be moderating. The first speaker will be Katy Murdza, who is the Advocacy Manager for the Immigration Justice Campaign. You'll be hearing from two individuals who are affected by this directly. One, her pseudonym is Ava. She's a former detainee in the South Louisiana ICE Processing Center. She's a Cuban asylum seeker. Then we'll be hearing from Freddie, who this is also a pseudonym. He is a former detainee as well from the El Paso Service Processing Center. He's also from Cuba and also seeking asylum. Our policy counsel, Lady Perez Davis, will be interpreting for us today since they only speak Spanish. And we're very glad that also on the call, even though she will not be speaking directly, is Linda Chorchado, the Legal Services Director of Las Americas, who represented both of these individuals. So we're so glad to have you on with us, Linda. I will be closing off the remarks with specific recommendations for what we would like to see happen given these dire circumstances. So without further ado, what I will just say for introductory remarks before passing this over to Katy Murdza is that AILA and our partner organizations are deeply concerned that the COVID-19 pandemic has fundamentally changed life across the country. And during this national crisis, Americans are looking to our government to unify the country and protect the health, safety, and livelihoods of all communities. But unfortunately, not enough has been done to ensure that immigrants and non-citizens are being protected. And this is putting so many lives at risk, not the least of which are people who are currently detained in many facilities, indeed dozens and hundreds of facilities across the country, contracted with ICE or directly operated by the government. Jointly, the Office of Civil Rights and Civil Liberties, that details the cases of 17 individuals who were detained in 11 facilities across the country that shows systematic failures by ICE to protect these individuals and the public. I am now proud to introduce Katy Murdza from the Justice Campaign to present the findings and to detail what they discovered. Katy?
Thank you, Greg. As the Advocacy Manager of the Immigration Justice Campaign, I work to advocate on behalf of those who are in detention centers across the country. The Immigration Justice Campaign is a project of the American Immigration Council and AILA, and we recruit, train, and mentor volunteer attorneys to represent detained immigrants in detention across the country in partnership with local legal service organizations. And on May 7th, the American Immigration Council and AILA filed an administrative complaint to the two Department of Homeland Security oversight agencies, the Office of the Inspector General and the Office for Civil Rights and Civil Liberties. 10 of our coalition partners signed on to the complaint, including the American Friends Service Committee, the Southern Poverty Law Center, and many El Paso area legal service providers, including Las Americas Immigrant Advocacy Center. The complaint draws on 17 firsthand accounts from individuals in ICE custody during the COVID-19 pandemic at 11 different facilities. The Justice Campaign has been speaking out about these concerns since the beginning of the pandemic, but filed this complaint as the situation was escalating in detention. Shortly before we filed, a study came out predicting that 72 to 100% of those detained in a facility with an outbreak would be infected within 90 days. And we filed just the day after initial reports of the first COVID-19 death in ICE custody. Unfortunately, we recently learned of another COVID-19 death of someone in Marshall's custody in a facility where others in ICE custody are also held, and of another death of a man who likely contracted COVID-19 before his release from ICE custody. ICE's failure to take measures to prevent the spread of COVID-19 was reported by all 17 individuals in the complaint, including one who has a degree in hygiene and epidemiology. They told us that they had no ability to social distance because they were sleeping just a few feet apart in bunk beds in dorms of up to 120 people. One man described that he was using the bathroom sink to add water to his instant soup right next to and in sight of someone using the toilet. People reported that there was not access to personal protective equipment. Most did not receive masks until late April, and even those were disposable and are only replaced once a week, if at all. Staff were reported to not be wearing masks, and even though they were touching those who were detained and their belongings frequently, and sometimes coming to work sick, including the kitchen staff. The people that reported to us for this complaint said that they were sometimes coerced into signing forms releasing ICE from liability regarding COVID. They believed that's what they said, but often did not understand them because they weren't in their language. And they had to sign these in order to receive masks. And the coercion took various forms, even including physical assault. They also repeated a lack of cleaning supplies. Insufficient soap was almost universally reported. And people sometimes described using 1 bar of soap all week to wash their hands, body, hair, and even clean their dorm. They sometimes reported having to clean their own living space, but not having the supplies. Some tried to clean the room with shampoo. The medical care was also insufficient. People reported a lack of testing and screening of new arrivals and transfers before being introduced into the general population, and a failure to provide almost any care or isolate those who were symptomatic until they were in critical condition. Some described seeing people carried out on stretchers after having their condition being ignored for days or weeks. We also heard about the detention of individuals with serious underlying conditions. We reported on 2 people who were in remission from cancer whose doctors had told them that they were immunocompromised due to their treatment, including Ava, who we will hear from today. And ICE can use humanitarian parole to release all of these people, especially with these conditions. Many have followed procedures to seek release and have been ignored. Many of the reports also included a description of transfers between facility, which allows further spread of COVID-19, including several from a group of 72 who were suddenly transferred to Prairie Land Detention Center in Texas in mid-April from Buffalo Federal Detention Facility and from Pike County Correctional Facility in Pennsylvania. 21 of those 72 later tested positive for COVID-19. There was a lack of personal protective equipment and social distancing in transit during these transfers. And 1 man tested negative right before the transfer and tested positive soon after arrival. We also heard finally about retaliation in the form of pepper spray, rubber bullets, lockdowns, solitary confinement for anyone who spoke out against the lack of COVID-19 protections. There was a hunger strike at Otero County Processing Center opposing the lack of personal protective equipment and cleaning supplies, and tablets used for video calls were taken away. We'll also hear today from Freddie, who was put in solitary confinement for participation in hunger strikes, demanding safety precautions. These accounts, unfortunately, are consistent with the reports we continue to hear from individuals who remain detained. One of our partners has informed us of a woman in the El Paso area who was left in the general population for over a week after developing COVID symptoms and later tested positive. And she's now being housed in a mixed group of women, some of whom have tested positive and others who have not. ICE has released several hundred individuals in recent weeks for COVID-related reasons, but this is a very small number compared to the approximately 28,000 still detained. And unfortunately, we have learned that some Justice Campaign clients are among the over 1,000 who have tested positive. Given that only around 2,000 have been tested, this number is likely significantly understated. ICE must take immediate steps to further significantly reduce the population of individuals in immigration detention.
Thank you so much, Katie, for giving us that overview of the really compelling circumstances facing these individuals. And I know that only scrapes the surface of all the detailed accounts that you provided into the complaint. We are next going to hear Ava, so she has the instructions on how to unmute herself. Go ahead, lady.
Thank you, Greg. Eva, ¿nos escucha?
Sí.
Ok, esta es la parte donde usted puede contar su historia.
Ok, bueno, yo estuve, en el tiempo que estuve en detención, la verdad que la pasé muy mal.
In the
Número
time that I
uno,
was in
por-
detention, déjeme yo traducir, okay? In the time that I was in detention, I must tell you that I had a very, very bad time. Puede seguir.
número uno, por la mala atención de los oficiales de ICE.
The first thing is how bad I was treated by ICE officials.
El número dos, por el trato de las mises dentro del centro de detención, que nos maltrataban mucho verbalmente.
And the other, number two is how badly we were treated inside the detention center. We were very, very badly treated.
Bueno, después que se empezó a complicar el problema sobre la pandemia del corona, yo empecé a asustarme mucho.
¿Me puede repetir eso?
Después que empezó el problema de la pandemia del coronavirus,
After the pandemic of the coronavirus started getting very bad. Siga.
ahí fue cuando empecé a preocuparme, porque como yo tengo una condición de tratamiento bajo cáncer,
That's when I really started to worry, because I do have a medical condition. ¿Qué me dijo la condición?
cáncer de seno.
I have breast cancer.
Realmente fue súper sorprendente. Yo estaba súper asustada, porque yo no veía que había ningún tipo de cuidado dentro del mismo centro. No nos daban nasobuco.
Permítame. I was very, very scared, because I didn't see that they were giving us any type of protective equipment. We weren't getting anything for the hands. Siga.
Tampoco nos daban, nosotros dormíamos muy cerca unos de la otra, no había la distancia que uno tiene que tener entre una persona y la otra.
We were sleeping very close to one another. There wasn't very much distance between one person and the other.
Los materiales de limpieza que veían no eran los indicados, no había cloro, no había desinfectante, solamente te daban un detergente líquido.
The cleaning products that they have were not adequate. There wasn't Clorox, there wasn't disinfectant. There was only this liquid, ¿líquido de qué?
Como un detergente, como un jabón líquido, ¿ves? Es lo único que daban. Eso no quitaba la suciedad, ¿entiendes?
The only thing that they gave us was this liquid detergent that didn't even clean the dirtiness off of us.
Lo más importante, que fue lo que más me sorprendió, que yo estuve súper asustada, fue que un día yo tengo que hacerme un tratamiento, porque me van a hacer unas pruebas fuera del centro de detención, y cuando me llevan sin ningún tipo de seguridad.
Permítame. One of the things that scared me the most was I had to get a treatment done for the medical condition that I have. Puede seguir.
Y entonces yo pedí que por favor me pusieran una nasobuco y unos guantes para ir fuera del centro, porque iba a un hospital oncológico a hacerme unas pruebas. Me dijeron que no era necesario.
I asked if I could get some gloves and I could get a mask, because I had to go to a hospital to get this treatment done for the medical condition that I have, and I was told that it was not necessary. Siga.
Entonces cuando llegué al hospital se sorprendieron mucho. Entonces las muchachas del hospital sí me trataron muy bien y me dieron todo lo que necesitaba y me desinfectaron para poderme hacer las pruebas.
When I finally got to the hospital, the doctors and the nurses that took care of me were very surprised that I didn't have any personal protective equipment on. And that's when I was able to they helped me disinfect my hands and disinfect the rest of me so that I could get this medical procedure done for the breast cancer. Siga.
Cuando terminé de ahí, le pido por favor que si me podía quedar con el nasobuco y con los guantes para llevármelo para el centro, y me dijeron que no tenía problema a las personas del hospital. Pero cuando llegué a la recepción del centro, me lo quitaron todo. Me dijeron que yo no tenía ninguna necesidad de tener nada de eso puesto, porque no había nada, como que no pasaba nada.
Permítame. So when I asked them if I could keep the gloves and the mask that I had been given at the hospital to take it back to the detention center, when the ICE officials were in front of the hospital officials, they told me that I could. But when I got to the detention center, they told me that I couldn't bring it into the detention center because I wasn't going to need it. Puedes seguir.
Hubo también personas que yo vi que estaban con síntomas, se las llevaban para el centro médico, que es ahí mismo, y las regresaban de nuevo para el dormitorio.
There was also people that I witnessed that had symptoms that were taken to the clinic within the facility, and then they were returned again to the dormitory. Puedes seguir.
No le dieron tratamiento médico a ninguna de esas personas, y yo asustada pensando, yo decía, Dios mío, sálvame y cuídame de todo eso, porque de alrededor mío habían personas súper graves con gripa, con la influenza.
Permítame. So around me, there was a lot of people that had these symptoms, and I kept on praying to God, asking him to protect me and to save me, because there were so many people around me that had influenza-like symptoms or other types of symptoms. Puedes seguir.
Entonces, incluso con esos mismos síntomas, no eran capaces de hacerle las pruebas a todas las personas para ver qué cosa era lo que pasaba. Solamente se llevaban a una y la obviaban y la regresaban, y uno no sabía nada, no te explicaban nada, no te decían nada.
Even with people that had symptoms, they were not getting tests done. All that would happen was that they were removed from the dormitory, they were taken to the clinic, and then they were returned to the dormitory. And no one ever explained to us, at the rest of the people in the dormitory, what was happening, or if they had tested them for something. Puedes seguir.
Ahí como único te podían tratar era solamente si te desmayabas en el piso y te caías y estabas muerta ya, era como único ellos te sacaban para atenderte. Si tenías algo, falta de aire como yo, que yo soy asmática, la Miss me decía, tienes que estar muy grave para llevarte al médico. Yo le decía, falta de aire, necesito oxígeno.
Permítame. You have to basically almost be dying for them to treat you. Basically, you would have to be fainting on the floor in order for them to actually get you some medical attention. For instance, I have asthma, and I was told several times that unless I was having an attack or I was doing very, very bad, they weren't going to treat me for anything. Puedes seguir.
Todas estas cosas que yo te estoy explicando, lo vi yo con mis ojos, lo viví yo en carne propia. Realmente es
all these things that I'm explaining to you all, I lived myself. I saw it with my own eyes, and it was my experience.
Fueron muchos días llorando, muchos días de incertidumbre. No son capaces de ir a los dormitorios, las personas de ICE, darte una explicación, decir lo que está pasando.
There were many days that I spent crying and that I spent incarcerated, and no one was able to come to the dormitory to explain to us what was happening.
Incluso si uno, por ejemplo, le decía a los familiares algo sobre lo que estaba sucediendo, o a los familiares lo que estaba sucediendo, o le hablabas a algún abogado, en este caso que yo los tenía, para decirle lo que estaba pasando en el centro, vino el jefe, el administrador, a amenazarnos un día.
In fact, actually, when folks, when you would talk to your family, or in this case, when I would talk to my lawyers, which I did have them, and would explain to my lawyers or my family what was going on, the one day that I did explain to them, the administrator of the ICE facility came to me to threaten me. Dígame.
Nos dijo, se paró frente al dormitorio y nos dijo a todas que si seguíamos nosotros comunicándonos con los abogados, con los familiares y diciéndoles las cosas que estaban sucediendo dentro del centro, nos iban a poner cargos federales.
And so when he came, he talked to all of the people in the dormitory, including myself, and he told us that if we were to continue to tell our families and our lawyers what was happening within the detention facility, that they were going to give us federal charges. Puede seguir.
Entonces que también si nos iban a suspender el servicio de las tablets, que era el único modo de comunicarnos, que nos iban a cortar el teléfono y que lo único que nos iban a dejar era la comisaría. Y yo le dije, claro, la comisaría la van a dejar porque ustedes se están beneficiando contra de nosotros.
Permíteme.
Permíteme.
So he told us that on top of the federal charges, that if we continue to talk to our families and our lawyers to explain to them what was going on within the detention facility, that they would take away our phone privileges, they would take away all privileges except for the commissary. Puede seguir.
Entonces, imagínense con todas estas cosas que sucedieron. A veces uno tenía hasta miedo, yo estaba aterrada allá adentro, rezando porque no me diera un catarro, porque no me pasara nada. 2 veces sucedió que fui al médico y veía a enfermeras disfrazadas de cosmonauta, como si fuera como las medidas que toman para las personas que tienen este tipo de enfermedad de corona. Y yo preguntaba y me decían, no pasa nada, lo único que estamos es medicando a una paciente que está enferma. Y yo, y así
Permítame.
vestida.
Permítame. In fact, I was so terrified inside that facility. There were some times where we would see nurses come in and they were dressed in full PPE uniform, like for people who were being treated for coronavirus. And when we would ask them, what's going on? Why are you dressed like that? And they would say, oh, we're just giving a medication to somebody. And we would ask them, well, do you have to be dressed like that in order to give the medication? Puedes seguir.
Y entonces me decía, sí, es para medicar a una persona enferma. Yo le decía, no, usted, yo no soy tan bruta como para saber que cuando una persona está así, tan enmascarada, es porque algo sucede y algo grave. No me van a decir que es para medicar a una persona, porque cuando uno va a medicar a una persona, uno no tiene que vestirse así de esa manera. No tenemos más nada que explicarle. Usted no puede estar preguntando mucho, era lo que me decía. Un maltrato verbal total.
I would tell them that I knew that I wasn't dumb enough to think that they were dressed in all of these things that they had on with PPE, to think that they were just simply giving a medication to somebody. I told them that we knew that there was something else had to have been going on, but they wouldn't tell us anything. Muchísimas gracias. ¿Quiere terminar con decirle algo al grupo?
Sí, yo solamente quiero decirle a todo el grupo que son lo mejor que tenemos nosotros, las personas inmigrantes que estamos dentro, que no tenemos ni para dónde tener para defendernos, que les agradezco infinitamente a cada uno, a Linda por todo el trabajo tan bonito que hizo conmigo, por la atención, a Max, que es una persona súper divina.
Permítame un momentico, déjeme traducir. I wanted to thank my lawyers, and I wanted to thank all of the people who are working with this issue. Linda, she was saying that Linda was such a great advocate for her. Si quiere, Eva, puede continuar diciendo su historia. Creo que la otra persona que iba a estar en la llamada no puede estar. Si usted quiere decirle algo más al grupo, tiene más tiempo.
Sí, yo le quería decir también que si no hubiera sido por ustedes, principalmente por Linda y Tomás, que se dedicaron, tuvieron gracias por su tiempo, gracias por su esfuerzo, también gracias por haber tenido también otras personas que me apoyaron también, pero gracias a ellos dos yo estoy aquí donde estoy yo hoy, porque si no, yo no sé dónde yo estuviera. Seguramente me hubieran regresado para mi país, me hubieran matado allá, porque están en las condiciones que uno pasa.
The conditions that we were in were very bad. If it hadn't been for my lawyers, if it hadn't been for Linda and for the people who have fought for me, they probably would have sent me back to my country and I would have been killed in my country.
Y les voy a agradecer todos los días de mi vida. Los tengo y los llevo en mi corazón porque hicieron un gran trabajo. Max se portó divino y Linda ni hablar. Era todos los días si me pasaba algo, si tenía algo, cómo me sentía.
My attorneys were the only ones that. My attorneys were the only ones that were in contact with me every day. They would ask me if I was eating. They would ask me if I was sleeping well. They were the only ones that had constant contact with me.
Y Linda, todo el esfuerzo que hizo con los reportadores que eran súper malísimos, los reportadores que no cogían ni en los teléfonos, no te atienden, no quieren darte explicaciones. Los veía por el centro y querías hablar con ellos y te decían así de lejos como si tú fueras un bicho. No, hablar no. Yo no tengo nada que hablar con ustedes.
Whenever I would try to get information from the ICE officials inside the facility, they would always push us back and they would yell at us and say, no, I don't want to talk to you. There's nothing that we need to talk about, almost as if you weren't human.
La verdad que yo por ese lado fui bastante afortunada por tenerlos a ustedes. Yo no sé qué hubiera sido de mí, porque con todas las cosas malas que yo pasé ahí adentro en 4 meses y medio. 4 meses y medio, la comida pésima. Usted sabe qué cosas tener de comer: maíz hervido, habichuela hervida, papa hervida y un pedazo de pan todos los días. Eso no es comida
Uh,
para una persona que tiene mi
every
condición, ni para mí, ni para nadie.
every single day they would give us boiled corn or boiled potatoes or anything that was boiled, and I was there for 4.5 months. That isn't adequate food for somebody with my condition. It is inadequate nutrition. And I was so fortunate to have Linda and my lawyers who were representing me during these 4.5 months.
Lady, why don't we go ahead and pause right now, and I think there'll be more time for questions to give Ava more opportunity to kind of tell her story. So thank you, Lady, for interpreting. Y Eva, gracias por contar tu historia hoy y por tu fortaleza para soportar lo que pasó en detención. Will you tell her, Lady, that we will, if she can stay on, we will, there may be questions that some of the congressional staff may want to ask her.
Eva, si nos puede dar el resto de la hora. Ahora mismo vamos a seguir con la programación, pero al final quizás alguno de las personas que trabajan en el Congreso le van a tener alguna pregunta. Entonces yo voy a poder traducir la pregunta. ¿Se puede quedar?
En estos momentos necesito, aunque sea un break de 15 minutos. ¿Puede ser?
Sí.
Excellent. So I'm going to give some very brief remarks about the recommendations that we have made about this, and then we're going to open it up for question and answer. We are not going to be able to hear from Freddie, the other former detainee, just due to technical difficulties. We're sorry about that. That's part of the reason we gave more time for Ava to tell her story in a more complete fashion, so you would get a sense of how terribly difficult and really inhumane the conditions are in at least one of the facilities there that very much are borne out in the other 16 case examples that are provided in the complaint that we sent. So the recommendations that AILA, the American Immigration Council, and the Justice Campaign have sent to the Office of Civil Rights and Civil Liberties of DHS hopefully are very clear and simple. Given what you've heard, they should in fact be obvious. First of all, we are asking that ICE exercise its discretion to the maximum possible level to exercise its parole authority to release individuals who are in custody and consider using alternatives to detention rather than keeping them in custody. In addition, to protect not only detainees but also the public, ICE should stop transferring individuals for whom they may have symptoms or they might be exposed to COVID-19. They should stop transferring people between ICE detention facilities. And our concern is that failure to do so will further disseminate the virus throughout the detention facilities, as well as to local communities, which will jeopardize their local community and the public health system there. The lack of hygienic products, something that Katy described in detail, as did Ava, is something that absolutely needs to be addressed. ICE should be providing immediately these kinds of necessary products and personal protective equipment to all detainees, and also should be requiring facility personnel to use them and to be provided with them. We're asking ICE provide better reporting of cases of individuals who have been confirmed with COVID-19, and as well as cases involving the facility and any individuals that might be moving in and out of those facilities at this time because of the risk that it will spread the virus to other individuals in detention or outside. And finally, with respect to just the detainees, testing absolutely has to be provided for COVID-19 for individuals that are in custody who have been exposed to the disease or who are exhibiting any kind of symptoms. We have not seen any of these practices done consistently, and we are urging members of Congress to continue to ask questions to make this happen. In addition, one development that needs to more work on is access for counsel and for the detainees to telephones. We're very pleased to see that a bicameral letter was sent just a few days ago in the Senate led by Senators Klobuchar and Durbin, and in the House by Representative Lofgren and the chair of the Judiciary, Nadler, asking for ICE to actually provide the access to telephones. ICE has said they would give up to 520 free minutes of phone access per month for detainees. But what AILA is hearing from our practitioners and other advocates are hearing about this is that it's been very inconsistent in terms of how this is being done. So more follow-up needs to be done to ICE, and we hope that they will respond to the congressional letter. The last area that I just want to flag is that court proceedings, immigration removal proceedings, continue for detained individuals. And as yet, we have not seen that the court has established smart and consistent protocols to ensure the safety of court personnel as well as the detainees themselves. Our first request there is that the court system should be suspending the detained docket. AILA sent a letter to Congress and to the agencies asking for the facilities for the detained docket to be suspended, as well as other dockets. Only the non-detained docket so far has been suspended. And we're joined by the National Association of Immigration Judges in that letter, as well as by the ICE Office of Principal Legal Advisor, which are the ICE prosecutors. So we spoke in unison on that concern, but it has not happened yet. A couple of other things regarding the court operations. The courts can conduct custody determinations and redeterminations for much of the population that is in detention. Not everybody is eligible for that in front of the court, but everybody the court has jurisdiction over should be given an opportunity to have their case reviewed by a judge. This would help expedite releases, but ICE and the courts should bear that responsibility jointly. Finally, there's not consistent practices right now regarding allowing people to appear by telephone for their proceedings, nor is there consistent practice regarding granting of continuances during a time where when it is extremely difficult for people to prepare their cases under this pandemic. So we're asking that the courts improve and issue consistent recommendations and policies for when to allow people to continue their cases. This should be granted as a presumptive rule rather than one that puts the burden on individuals who have very little time to prepare. And the same thing, people should not be required to appear in person if they can appear telephonically. So those are the recommendations that we are asking that the agencies respond to, and we're hoping that members of Congress will also assist and join in these recommendations. This concludes our formal presentation, and we're now going to move into a question and answer period.